Hey, this is Nathan Schrupp with Master Medical Equipment. I want to talk to you today about the advantages of using the Sapphire pump over other options that are currently on the market today. It's a multi-therapy drug infusion pump. It's only one of two that are actually rated for transport, so if this is ground EMS or air EMS, this is your go-to. It's smaller, it's compact, it's lightweight, makes it very versatile in those type environments. It's also great for home infusion use. You're not having to carry in a bigger infusion pump. We're seeing this more in our clinic settings as well, and it's a little bit smaller, more economical for our services. The most important purpose of using this pump over other options out there is because of the precisions that it carries with it. So you can, ease of use, you can plug in the patient weight. When I first started learning how to do it, we had to calculate all that. This takes all the guesswork out of those calculations, especially if it's a population or a very critical patient where we have multiple things going on. So I'm going to show you just how quick, by this time clock over here, how fast we can do this. So we're going to hit New Infusion, and let's say we're going to give dopamine. So I'm going to click D, and I'm going to hit Find, go to the next screen, click dopamine. We have 800 milligrams and 250 ml. We're going to say our patient weight is 70 kilograms. The dose rate, we're going to start out at 5 mics per kilogram per minute. We know we're in 250 ml bag. We're going to hit OK to verify. We're going to hit verify, hit next, and we're going to hit OK one more time. Hit start. That's how fast it is to program that in. We have to challenge ourselves to do, step back for a moment as clinicians and say, hey, this is easy. I just hook this up and move, but I challenge you, is it really easy? Because we know it takes time to do the calculations, the math calculations and the formulas to figure out what type medication we're going to administer, and then for adult populations, for pediatric populations, and if you have a neonatal population as well. Having the Sapphire Infusion Pump, it frees us up, right? When we're in the back of the ambulance or we're in that ER setting and we're doing multiple different things for the safety of this patient, let's trust the process with these pumps. Let's trust the guardrails that are there. So it frees us up so we can do other things. We can take care of this patient, and we don't have to sit here and worry about doing the math. We don't have to sit here and worry about the accuracy of our math, because that's a stressor for us as clinicians. Like, man, did I get that right? Should I have moved a decimal 1 point over? And so why have that stress? Why have that burden when it's all done right here? And allow it and trust it to deliver the accuracy and the precision that they're made for, right? Let's take that stress off of us and place it on here where we can walk away knowing that, hey, that's infusing exactly where it's supposed to be, and I did everything right, and I did everything according as a clinician for the betterment of my patient. Look in the description, follow those links that are there, and then do your own research. Look at different case laws that are out there and different research articles, and kind of formulate your own opinion with what you have seen with your experience, and then with the knowledge that is presented in these articles. Reach out to Master Medical Equipment, knowledgeable sales reps to seek purchase, or if you like to test the Sapphire pump yourself, we can get this in your hands so you can start trying and formulate your own opinion and the accuracy of these Sapphire pumps.